is a critical skill for medical students, especially those headed into critical care or respiratory therapy. Hey everyone! Today I'm going to walk you through the open suction technique for endotracheal and tracheostomy tubes. This is a critical skill for medical students, especially those headed into critical care or respiratory therapy. Let's get started. First up, gather your supplies. You'll need a suction catheter, sterile gloves, saline, suction machine, and a sterile water container. Make sure everything is within reach before you begin. Step 1. Wash your hands and don your PPE. Safety first. Step 2. Connect the suction catheter to the suction machine. Ensure the machine is set to the correct pressure, typically between 80–120 mmHg for adults. Step 3. Pre-oxygenate the patient. This is crucial to prevent hypoxia. Give them 100% oxygen for about 30 seconds. Step 4. Put on your sterile gloves. Using a non-sterile hand, pick up the catheter and ensure it remains sterile. Step 5. Insert the catheter into the tube without applying suction. Go until you feel resistance or the patient coughs. Step 6. Withdraw the catheter while applying intermittent suction. Rotate the catheter as you pull it out. This helps clear secretions more effectively. Step 7. Rinse the catheter with sterile water to keep it clear. If needed, repeat the suctioning process. Step 8. Reassess the patient. Check their oxygen levels and listen to their breath sounds. Pre-oxygenate again if necessary. And that's it. Remember, practice makes perfect. Always follow your institution's protocols and guidelines. This skill can be life-saving, so take it seriously. If you found this video helpful, please like and subscribe for more medical tutorials. And leave any questions you have in the comments below. Thanks for watching and happy studying.